Eventually, neurons lose their ability to communicate. As neurons die, the brain shrinks, beginning in the hippocampus, a part of the brain important to learning and memory. People may begin to experience memory loss, impaired decision making, and language problems. As more neurons die throughout the brain, a person with Alzheimer's gradually loses the ability to think, remember, make decisions, and function independently. Achieving a deeper understanding of the molecular and cellular mechanisms and how they may interact is vital to the development of effective therapies. Much progress has been made in identifying various underlying factors. Advances in brain imaging allow us to see the course of plaques and tangles in the living brain. Blood and fluid biomarkers are providing insights about when the disease starts and how it progresses. More is also known about the genetic underpinnings of the disease and how they can affect particular biological pathways. These advances enable the development and testing of promising new therapies, including drugs that reduce or clear the increase of tau and amyloid proteins in the brain, therapies targeting the vascular system, glucose metabolism, and inflammation, and lifestyle interventions like exercise or diet, and behavioral approaches like social engagement that may enhance brain health. Research is moving quickly, ever closer to the day when we can delay or even prevent the devastation of dementia.
Thank you so much, Joel. I think you all got a basic clarity that what happens in Alzheimer's, but I'll again try to explain in our next slide. So basically, scientists are yet to understand the direct causes and mechanism. Joel, we'll move on to the next slide. But yes, they are able to understand that Alzheimer's may be a result from a combination of your genetic, environmental, and lifestyle factors. And basically, three changes happen. So if I like broadly say, basically three changes happen to the brain and the neurons in this condition of Alzheimer. First is your shrinkage of the brain happens because of maybe the lesser nutrients reaching, or the blood circulation is not happening properly. Because of that, what happens, your neurons and the neurons network starts getting destroyed, starts getting damaged. Secondly, what happens, there is a formation of amyloid plaque formation. Amyloid is nothing, it is a protein. Okay, it is a protein which naturally occurs in the body, but because of some reasons yet to be known, because of some reasons, these proteins starts getting accumulating together and starts making these plaques. Okay, these plaques then starts getting accumulated in between the two neurons and starts disturbing the communication between the two neurons. That means it starts disturbing the signals that is going from one neuron to the other neuron. Okay, so this is basically a plaque formation. So amyloid is a protein, because of unknown reasons, or because of inflammation, you can say, because of unknown reasons, this amyloid protein starts getting accumulated under over the neurons, and it starts disturbing the signals which is happening between the two neurons. Okay, third thing, the formation of neurotangles. Okay, the formation of neurotangles. Neurotangles is basically formed because of tau. You must have heard in the video also. Tau again is a naturally occurring protein, but this protein gets built up inside the neuron in the form of ribbon like structure, in the form of thread like structure. Okay, so amyloid gets accumulated as the plaque, and the neurotangles gets accumulated in the form of thread like structures inside the neuron. Now when it gets accumulated inside the neurons, it basically blocks the ability of neurons to communicate, that means send signals, as well as it blocks the ability of the neurons to transport the nutrients also. So when the transportation of nutrients is not happening, without the nutrients, gradually these neurons die. Okay, so basically three things are happening. Your shrinkage is happening because of nutrient deficiency, because of low glucose, because of the less blood reaching to the brain. Secondly, plaque formation, and third is the tangle formation. So, for reasons not well understood, these plaques and tau take over the healthy brain tissues. Okay, and what it does, it destroy the areas of brain specially associated with intellectual functions. Intellectual functions, and that's why all these intellectual things like thinking, memory, your decision making, all these things gets hampered, especially in case of Alzheimer's. Okay, so now since we have understood that what are the problems associated with Alzheimer's, now we'll see that how we can detect the early signs. Because when we are able to detect the early signs, we are able to reach to a diagnosis early, and we are able to improve the quality of the life of the person who is affected for a longer time, because we can take some preventive measures accordingly only. Okay, so first, you will be able to see in early signs that memory problems are happening. Like the person will be asking repetitive questions. Okay, he's not able to analyze what you are asking. Okay. Secondly, he'll be forgetting names of very close people also. He'll not be able to remember the names. Okay, and your sometimes it will be memory lapses, like he wants to tell about an object, but he's not able to take out the name of that object. So that way memory lapses will be happening. Difficulty in communicating, that means the person will not be able to find the right words, how to tell about a situation. They'll not be able to find the right words, and forgetting the name of the objects again. Poor judgment, so they'll be taking random decisions without any logic or without any reasoning behind it. So they'll be doing taking decisions based on poor judgment. Okay. Fourth is your mood and personality changes. The person will start withdrawing himself or herself from social gatherings. They'll stop interacting, because since they have a hindrance, they are not able to communicate, they are not able to understand. They'll start doing this social withdrawal. Okay. And the last is your trouble with familiar activities. Trouble with familiar activities, that means earlier the person was making a food, and they are not able to they suddenly stop while making the food, thinking that okay, what to do next or which spice to put next. They'll stop doing the activity in between, because they are not able to understand what to do next. Okay. uh, they will face difficulty in doing basic day to day task also, which they were able to do earlier. So these are the early signs. If you're able to see any of your near ones, dear ones, any of your friends who are facing these issues, it's always important that go to the doctor, get it diagnosed, because they'll be doing a lot of tests which will let them understand that is it because of Alzheimer's, or there are other underlying conditions which is leading to that. Because since Alzheimer's is irreversible, it has to be detected early so that we can take care of the life of 8 to 9 years with a quality of life. We are able to improve the quality of the life of the person, because after diagnosis, majorly it is like 7 to 8 years of life expectancy is there of Alzheimer's person. Sometimes in few cases it may go further to 20 years also. It depends completely on how well you are able to manage the symptoms. Okay. So now after the early signs, what we have to do, we have to now understand that what are the sign and symptoms of that particular disease when the person is already been diagnosed with Alzheimer's. So we'll move on to the next slide, and we'll understand that what are the signs and symptoms. Okay. So you will be able to see on your left hand side, it's mostly your neurological symptoms, and on your left hand side you will be able to see it's more of your physical symptoms. So on your neurological symptoms, you're able to understand that there will be a confusion with the time and location. They will not be able to guess the direction where their home was. Withdrawal from the social activities, trouble with the images, poor judgment, difficulty in solving problems. Simple problems also, they'll be not be able to solve the problems. Difficulty in completing the familiar task, misplacing items, like they're keeping somewhere but they're forgetting where they have kept it. Memory loss, right? They are not able to manage their emotions. They will suddenly become agitated, they'll suddenly become frustrated, they'll be anxious all the time, and difficulty with words, they'll not be able to communicate to people. Okay, so these are basically your neurological symptoms. Now comes the physical symptoms. Physical symptoms, because there will be a damage to your cerebellum, they'll be able to see loss of balance and coordination, right? They'll not be able to coordinate the right hand with the left hand, or all those doing those activities and all. Okay, they'll not be able to maintain a proper gait also, that means the walking style. Muscle weakness will be there, fatigue will be there. They'll be able to see a lot of sleep disturbances. They'll be having trouble controlling the bladder and the bowel movements, which happens in the later stages of Alzheimer's. And in the later stages of Alzheimer's, they'll be able to face some seizures also, because it's completely dependent on your brain. So definitely seizure can be a condition associated with the physical symptoms. Okay, so now we'll move on to the next slide. Now we are knowing that yes, what are the symptoms of Alzheimer's. Now we'll move on to what are the types and what are the stages of Alzheimer's. Okay, see why it's important to understand the symptoms have just started. You can start taking care of the person who's affected, so the quality of life will be much more better. Okay, so types of Alzheimer's. First is your early onset Alzheimer. Early onset Alzheimer basically happens, so generally it happens in 65 plus, but in early onset, the signs and symptoms starts happening from at the age of 40s and 50s only. And the sign and symptoms worsen quickly also, because the onset is early, so the sign and symptoms worsens quickly also. And these are mainly 5% of all the cases, and especially found in Down's syndrome people. Okay, especially found in Down syndrome people, which we have already discussed. They are always at a higher risk. Second is your late onset. Late onset is the most common one, which comes with the later age of 65 plus, and the sign and symptoms worsen very slowly. And the last is your familial Alzheimer's. This is a rare type, and this is basically because of the genetic changes passed down from the parents or from the family to the child. Okay, so these were the types of Alzheimer's. Now moving on to the next are the stages of Alzheimer's. As I said, that after the diagnosis, the life expectancy of a Alzheimer's person is maximum, like minimum at least 7 to 8 years. So as per that, it actually progresses also. So as per the stages, first is your Alzheimer's stage, which lasts for almost 2 years. Duration is 2 years, and it starts with basic symptoms, like they keep on getting lost, they'll not be able to find the directions. Reading problems will be there, they'll not be able to understand the words, the letters. They'll not be able to recognize familiar people, and the direction sense will be lost. Okay, second is your moderate Alzheimer's. Again, it lasts for 2 years again. In this moderate Alzheimer's stage, it will be poor judgment. They'll not be able to judge the condition. Their decision making capacity will be affected. They'll be very impulsive, they'll be very confused, hallucinations, paranoia condition will be there. Okay, and the last is your severe Alzheimer's. The condition lasts for 3 years. This all the conditions become worse and worse, related to memory and everything, definitely. Apart from that, inability to communicate, seizures will be there, weight loss will be there, and there will be no control on bowel and bladder functions. Okay, so that is the severe Alzheimer's stage. Okay, so these were the types and stages of Alzheimer's. Now now since we have understood at least a gist of Alzheimer's, that what is Alzheimer's and what are the functions that gets affected, so now we can talk about few measures that we can take when we are dealing with the Alzheimer's person. Okay, so what are the measures that we can take to take care of Alzheimer's person? So first is communication, because communication is very important when we are dealing with the Alzheimer's person, and that is the most affected part also, because it becomes very difficult. Okay, so on your left hand side, it's like 5 tips uh, for talking to someone with Alzheimer's. Diminish distractions so that the person is able to focus on your voice. So avoid all the background noises. sit in a quiet environment if you really want to communicate to the Alzheimer's person. Okay, one to one conversation is better, but because when you're talking in a group, the person is not able to follow, and it will create a lot more confusion to the person. Okay, keep the things simple. That means ask very small questions, very straightforward questions, so that the person is able to follow your question and is able to answer it also. Avoid arguments, because the person is not in a condition where the person is able to judge that what is right and what is wrong. So try to avoid the arguments, maybe in sometimes agree also, so that the conversation is getting stopped there and the person is not feeling agitated. Okay, just keep talking. Now keep talking even if the person is not responding. The person is not responding, it's not because they don't want to respond, it's because they can't respond, because they are not able to assess your words, they are not able to judge your words, they are not able to like process the whole thought process that how to answer for this question, right? So keep on talking to them, because the emotional thing is still there, right? So if you keep on talking like you're talking 5 sentences, they'll definitely answer at least for one, right? So at least some amount of communication still will be there from the person who is affected from Alzheimer's. And there are 10 points on Alzheimer's communication. Like, I'll just point out few. Never argue, instead agree, right? Never reason, instead divert, because they are not in a condition to reason. So there's no point of talking about reason. You can divert to some other topics. Okay, never lecture, instead reassure. So we all are always in a condition of stress and all. So when we deal with Alzheimer's people, we always say you should do this, we have to do that, right? All these things. So try to reassure about the person's condition, that yes, all will be well, or we are going to do this, we are going to do that, that way. Okay, never say I told you, instead repeat. You cannot tell I told you, because the person has a memory problem, so they'll not be able to follow your words which you have said like two days back, right? So instead of that, you can repeat the same thing which you want to communicate to that person. Okay, never say you can't, instead you can say you can do. Never demand, just ask. Don't say do this, do that. Let's can we do this, can we do that, right? Can we put this plate there, can we sit for a discussion, or can we have this, right? So that way. And always encourage them, and don't force them to do anything particular, because they are not in a condition mentally to process all the thoughts that you want to deliver to them. Okay, so these were few measures you can like matlab implement in your day to day life if you are dealing with some Alzheimer's person. Now next, since we have spoken about communication, let's talk about the nutrition part also, which definitely plays a very very important role. So moving on to the next slide, there are certain tips, I'll not nutritional tips plus lifestyle tips are there. So first is your flex your brain power. Okay, these are the tips which, so it's not for the tips who is already having Alzheimer's. It's for the tip. These are the tips for the people who want to who are at a higher risk definitely, and who want to delay it for a longer time. Okay, or who want to completely reduce the risk of getting Alzheimer's. So first is your flex your brain power. So if you know that yes, Alzheimer's was there in my family and I don't want to get it like in my future, so then keep involved yourself in some intellectual activities, right? Like you're reading, solving puzzles, because research says that if you are getting involved in all these intellectual activities, you're actually reducing the risk of Alzheimer's disease to 47%. Okay, so if you are using those neurons in a much more better way, right? So that's why it'll help you to reduce the risk of Alzheimer's disease. Second is your eat healthy, right? We all are aware that eating healthy is overall good for your for our own health in for each and every system of ours. So definitely it is very very important for your brain health also, right? So all colored fruits and vegetables, all your especially purple colored fruits and vegetables, your good fats, all these healthy eating habits will actually reduce the risk of your cognitive function decline by 48%. Cognitive functions, that means all your special capabilities of your intelligence, of your doing something specific, your memory, your reasoning. your decision making, all these, it will reduce the risk to 48% if you start eating healthy. Okay. Third is your quit smoking. Very, very important. If you ask, as per the research, it says that heavy smoking increases the risk by 157%. Can you imagine? 157% it increases the risk of Alzheimer's disease who are heavy smokers. Okay. Fourth is pour a glass of wine. That is like on a lighter note, but actually I want to make you understand that especially the purple colored fruits and vegetables are very rich in polyphenol and anthocyanins. And when I was doing my phytonutrients, I must have told you also that this purple color is basically a phytonutrient for brain health. Okay. So these polyphenol and anthocyanins, especially found in purple colored fruits, are called as brain phytonutrients, like your berries, your strawberries, your grapes, right? And what it does basically, it basically reduces the plaque formation, which was the first starting point of your Alzheimer's disease, which was a precursor of your Alzheimer's disease. Okay. Blood pressure control. So blood pressure control again is very important, because if the blood pressure is high, definitely it will start damaging your nerve cells also. And if a healthy blood pressure is in the primary stage especially, delay the effect. So keep your blood pressure healthy as much as possible. Fatty acids, we are all aware that fatty acids are good fats. It reduces the inflammation process which is happening in our brain. It protects your nerves because your brain is almost made up of fats only. So if you're giving healthy fats, definitely it will improvise on your brain health. Moving, get moving, because it is seen in research that moderate, especially aerobic exercises, basically helps in strengthening your nerves and may help in multitasking, planning, these kind of abilities. Okay. So definitely do at least some kind of aerobic exercises. Stress and sleep, since both are related to our brain health, it is very, very important that you take care of your stress, find out ways where you can manage your stress, take care of your sleep so that the rejuvenation, the recovery of the brain is happening, the nerve cells is happening. So take care of your sleep. Stay away from the chronic diseases. Why? Because all the chronic diseases, especially your cardiovascular disease, right, the heart related diseases, if your heart is getting affected, or you are having a cholesterol problem or a heart problem, what will happen, it will definitely affect the blood circulation of your brain also. When the blood circulation of your brain will get affected, definitely it will create a nutrient deficiency, which will further lead to the brain cell damage. Okay. And the last, the supplementation. See, again, as I said, there is no treatment, there is no cure. The condition is irreversible. What we can just help is adding these supplements will help to improve the quality of life and will definitely help to cover the nutritional gap also. Right? Because since the person is not able to assess, the eating habits and everything will also get hampered. And definitely we can fill this nutritional gap by adding the supplementation. Okay. So this was all about your talk on the Alzheimer's. Now we will move on to how we can help these people with Alzheimer's through our supplementation. So the next slide says that what are the foods for the brain. You can see that all the saturated fats, trans fats, whichever is like bad for your health, it's bad for every system of yours, whether you're talking about your heart, your brain. So you can see that saturated fats, trans fats, your excess copper, your aluminum, these are very bad for your brain health. And on the other side, there are some your brain protectors, your vitamin E, that all your nuts and seeds are rich in vitamin E, all your protein rich food, your purple colored fruits and vegetables, your green leafy vegetables, right? Your folic acid is very important for your brain health. Okay. Your B12, all these are your, on the left hand side are the brain threats and on the right hand side are the brain protectors. So try to include all these healthy foods as much as possible so that your brain health is improvising on a daily basis. Okay. And now we'll come on to the supplementation, that how we can help through supplementation. So first is Brahmi, and we have all been knowing that yes, Brahmi is a neurotonic. Okay. It enhances your memory power and it it slows down the symptoms of your Alzheimer's disease. Okay, it helps you to relieve from stress and the adverse effect. All right. And how does this Brahmi helps? Brahmi basically helps in, first of all, it helps in the, it increases the information retaining capacity, right? It increases the capacity of information retention. Okay. Secondly, there is a active ingredient in our Brahmi called bacosides. Okay, so the research has told that bacosides basically helps in inhibiting the amyloid plaque. Okay, it basically inhibits the amyloid plaque formation, the bacoside especially, and definitely it protects against the plaque toxicity also. So that way Brahmi helps in Alzheimer's disease. Secondly is your ashwagandha. Ashwagandha, we all know, it is rejuvenative and has a calming effect on your brain. It also has an effect on reducing this plaque formation. Thirdly, it also helps in your stress and sleep condition. And fourthly, it slows down your cognitive decline. Okay, it slows down the progression of your Alzheimer's disease, right? So these are from your herbal range. The next will be from the neutralite range. The next, Joel will move on to the next slide. So on the left hand side, you are able to see coenzyme Q10. Now, what is coenzyme Q10? Coenzyme Q10 is basically found in each and every cell of ours, and it basically improvises the functioning of the cells. Now, all our cells still get rest, but our brain cells, our heart cells, these don't get rest, right? So these are continuously working. So this coenzyme Q10 level drops down in all these cells, and that's why when you are talking about Alzheimer's, when the cell functions are not happening properly, coenzyme Q10, it is seen that basically it has a potential role in reducing the oxidative stress, okay, oxidative stress of the nerve cells. So coenzyme Q10 basically helps in that. On the right hand side, you are able to see benefits of ginseng. Ginseng has a special compound called as ginsenosides. Okay, ginseng has a special compound called ginsenosides, which basically improves the brain functioning, reduces the inflammation, and again that also helps in formation of your amyloid proteins. It reduces the production of your amyloid proteins. So basically ginseng also helps in the Alzheimer's condition. And the last is your B complex, especially B12. It basically helps with your overall nerve health, right? So in the last side will be, you'll be able to see all the supplements which supports in this Alzheimer's condition or in boosting of your memory health. Okay, so we'll move on to the last slide, Joel. Yes. So you can see first is your ashwagandha, second is your Brahmi, third is your ginseng cherry plus, coenzyme Q10. So I put it in the priority basis. You can accordingly keep on shuffling depending on which problem the Alzheimer's person is facing more, right? So accordingly you can shuffle. Along with that, definitely we have our protein daily and omega. So it is seen that a high protein diet can actually reduce the risk of Alzheimer's. So definitely protein is there. And secondly, daily has a lot of antioxidants like your vitamin C, your selenium, your zinc, your vitamin E, your B complex. These are all again helpful for your brain health. And your salmon omega also, that is also again anti-inflammatory properties, and it's the food for your brain. So definitely this combination, you can use that. So this was all from my side. I hope I was able to cover all the points and make you understand slightly about the Alzheimer's disease and what is our role in taking care of these people. Joel, if you have any questions, I can take the questions now.
Yes, just give me a sec. So if you have questions, you can put it up on the chat and I will have a look at it. Should we take Brahmi, ginseng and CoQ10 on regular basis?
See, Brahmi and CoQ10 you can still take, but ginseng you can take maximum for 8 weeks. After that, definitely give a break. And then you can again continue. Ginseng, you should try not to continue more than 8 weeks.
Okay, how different is Alzheimer's to dementia?
See, Alzheimer's, So Alzheimer's has the main symptom of dementia, but dementia can be because of so many reasons, right? So Alzheimer's has a symptom of dementia, but dementia in itself can be a different disease because of so many underlying causes. Okay.
Okay, if you milk, can we take ashwagandha with hot water?
No, I'm not able to like follow the question, Joel.
Okay, if you are allergic to milk, can you take ashwagandha with hot water?
With warm water, yes, you can take, no problems.
Okay.
Or you can use other milk forms also. You can go for almond milk, you can go for your soya milk, anything like that.
Okay. What happens if we use beyond 8 weeks for ginseng?
There's nothing, but you'll not be able to see like visible results, because it's a kind of like it'll not give you that because see, your cells will get adapted to that thing, so you'll not feel that energy, or you'll not feel that improved functions for a longer time. So if you give a break and again if you're taking, then you'll be able to see more significant results, right? So there's no harm, but it is said that you should not continue more than 8 weeks to see better results for a longer time.
Okay. So do these supplements help people already having it or a symptomatic person?
Again, I'm not able to get your question, Joel.
So I think he means does taking the supplements help people who already have Alzheimer's or who are prone to get it?
See, both ways you can do. Like the people who are having already Alzheimer's, like imagine a person is just you know that okay, the doctor has told that it is just the first stage. If you're giving all these supplements, at least the sudden decline of the symptoms will not happen, right? The quality of life will be improved. And the people who are already are at a risk, if they start from now only, maybe they may not get the Alzheimer's in later stages. They can delay it for a longer time, right? So why not both of them? Because we are working on preventive basis, right? So it's for prevention also. And the people who are already having Alzheimer's, if you're giving these supplements, they'll feel more energized, their sleep will be much better, they'll be able to recognize things in a much more better way, right? So
Okay.
that way you can give both conditions, you can give.
Perfect. Can we give CoQ10 if a person is diabetic?
Yes, definitely you can give, no problems.
Okay. For 80 years, which are the supplements best to consume?
So 80 years, again, protein, daily omega, brahmi and ashwagandha.
Okay. Um, okay. So how long should we wait before we start the next course of ginseng?
Again, take a break of 2 months, take it for 2 months, take a break of 2 months, take it for 2 months, that way you can do.
Okay.
We have so many other supplements also, right? So you can, that way you'll be able to keep on shuffling also, and that way you'll be able to see the results that is coming from the other supplements also in the present condition.
Okay. Should we take Brahmi on an empty stomach?
So Brahmi, it is said that if you take it on empty stomach, it gives you better results. Like one Brahmi, what you can do is you can take it morning as soon as you wake up. You're taking some nuts, right? Along with that, you can take Brahmi rather than taking it completely empty stomach. And the second tablet, you can take it after your lunch. Ashwagandha, you can take it after dinner.
Okay. So all the products that you are given here are also for prevention also, right?
Yes, absolutely.
Yes. So for all who asked whether it's a prevention, yes, for prevention also, these products definitely will help.
And anyway, these supplements will help you with your overall health also. Like if you're seeing like Brahmi, Ashwagandha, we are all living in stressed environment, all our sleeps are getting disturbed. So if you're taking Ashwagandha, it's working on all your other health aspects also.
Okay. So there are some depression patients. I think this will be the last.
Depression patients, you can give like Brahmi and Ginseng Cherry Plus.
Okay, perfect. So we'll have to close the event right now because at 6 we have another event and the team has to prepare prior to the next event. And I think that's all the questions that have come. More or less, everything is almost the same. I first, before closing, would like to thank Sapna for all her great work that she continuously does. And the presentation was completely wonderful. All the information in that was really great. I would like to also thank all the participants for joining us today. It was really nice to see you all. And until we come up with the next event like this, kindly stay safe and stay protected. And before I close, Sapna, there are so much of good remarks coming in here saying thank you and it was a wonderful session and very informative. I just want to relay that to you as well. Thank you all.
Thank you. Thank you to all my participants here who always listen to me so patiently. Thank you for all the encouraging words. And thank you, Joel, for all the hard work that you always put up. And thank you so much for the work with the PPT as well.
No
Thank
problem.
you. Bye, all of you. Stay safe, stay healthy.